I'd like to welcome you all to the sixth in a series of webinars on age-friendly environments. Today's webinar is entitled Engaging Planners as Livable Communities Allies and will be presented by Ms. Stephanie Firestone and Dr. Laura Keyes. Stephanie Firestone is a Senior Strategic Policy Advisor for Health and Age-Friendly Communities with AARP International. In this role, she collaborates with international and national organizations to advance planning for livable communities for all ages and healthy aging, and to combat ageism. As a 2015-2016 Health and Aging Policy Fellow, Stephanie worked with the American Planning Association and the U.S. Department of Housing and Urban Development, helping local leaders to create more inclusive communities. Previously, Stephanie was Director of Livable Communities at the National Association of Area Agencies on Aging, where she worked with area agencies, cities, and counties to create multi-stakeholder partnerships, develop action plans, and enhance their capacity to create communities that are livable for all people of all ages and abilities. Tools she has developed for local change makers include N4A's 2015 publication, Making Your Community Livable for All Ages, What's Working, which was downloaded over 100,000 times in the first month after publication and has been used by thousands of communities around the country. She has a Master of Urban Planning from the University of Virginia. Laura Keyes is a PhD and ACIP certified planner and holds the position of lecturer in nonprofit management for the Department of Public Administration at the University of North Texas. Her doctoral dissertation examined age-friendly cities, the bureaucratic responsiveness effects on age-friendly policy adoption. Prior to embarking on doctoral studies, Dr. Keyes served as the manager of community planning and development in Atlanta's Area Agency on Aging. She served in multiple planning capacities in the areas of transportation, housing, and aging. She recently published her research specific to aging policy in Public Administration Quarterly, the Journal of Administrative Theory and Praxis, Journal of Aging in Emerging Economies, and Journal of Aging and Social Policy. On behalf of the IFA, I would like to thank Stephanie and Laura for presenting today. The IFA invites all participants to ask questions via the Questions tab on GoToWebinars. Questions will be answered at the end of the webinar, and should your question not be answered, I invite you to follow up with the IFA via the contact information that will be sent out following the webinar in our wrap-up email. That being said, I'd like to welcome Stephanie and Laura and give them the go-ahead.
Thank you, Jessica, and thanks for all of you for joining this webinar. I want to start just by essentially defining what we mean when we're talking about age-friendly communities, livable communities for all ages. So essentially, one of the most consistent features in surveys of older adults around the world is a very strong preference to age in their homes or communities for as long as possible. Therefore, it is both critical and urgent that professionals in key roles work together to put in place effective policies and programs that will make communities more livable for all ages, which we define as communities that ensure appropriate physical and social infrastructures for residents throughout an expanding life course. Two professional groups that are essential to this work are planners, who envision the form and help execute the future growth of communities, and then professionals in the field of aging, who often create plans to help people live well in their homes and communities across these extended lifespans. Therefore, we have focused on bringing these two professions together and on facilitating a shift in an approach to planning that addresses very rapidly changing demographic contexts in communities. So this webinar presents some findings from two distinct efforts to learn how better to engage planners in this realm. First, my colleague, Dr. Laura Keyes, will discuss a U.S. educational intervention, and then I will present preliminary findings from some initial international research. We'll then take some questions at the end, as Jessica said, and I look forward to your input also to help us learn where we need to focus our efforts moving forward. So I'll turn it over to you, Laura.
Thank you so much, Stephanie. And we're excited to share with you the findings from our educational intervention and hopefully further the practical application of some of the research work here. Next slide. So complex social issues, like creating age-friendly environments, require input and solutions from more than one entity. The idea and concept of community planning as a process for creating livable communities for all ages provides a platform for collaborative discussions among the public, stakeholders, and multiple professions. Here, two essential actors that we're covering are planners, given their role in facilitating community design and development, and the aging sector, relative to their role in providing services for older adults. The Livable Communities for All Ages educational intervention informed on tools for creating enabling environments. Our research interest is in understanding the factors that influence cross-sector collaboration between the aging and planning sectors. The event hosted by the American Planning Association, the American Society on Aging, and AARP in 2017 hosted or served as the platform for all of our data collection. We developed 3 different survey instruments, including a pre-event survey, a post-event survey, and an event evaluation. Now, this certainly was a purposeful event scheduled in conjunction with the American Society on Aging's 2017 National Conference. So it's not surprising that 45% of our attendees identified with the aging services sector. However, with effective recruitment in partnership with the American Planning Association and the Illinois chapter of the American Planning Association, we were able to increase participation with a representation of 25% from the planning profession. So now we're going to cover some of the lessons learned that we found from our data analysis. So over 61% of all attendees indicated some work initiated with the Livable Communities for All Ages efforts in their own local communities. Over 14% had indicated that they were currently partnering with their city or their regional planning agency, and that those two entities were serving as the primary leader on the Livable Community for All Ages efforts. While both professions show some basic interest in each other's profession, showing the aging sector interest in planning at 11% and the planning sector interest in 4%, are low, extremely low, there is an opportunity for building partnerships to overcome the enormous amount of work that is to be done. The summit itself demonstrated some level of effectiveness as a learning intervention, as there was a significant difference of the participant recognition of the value of cross-sector collaboration relative to Livable Communities for All Ages before and after the event. This is not entirely surprising, as the 8 World Health Organization's domains for creating age-friendly cities are essentially relevant to many different professions. Identifying points of commonality are important for goal alignment and collaboration. Participants were asked to identify the Livable Communities for All Ages characteristics most important to their work. A correlation analysis indicated that health was significant as a characteristic for both sectors. Again, this isn't entirely surprising, given that many of were there for the American Society on Aging's National Conference, where health is a major component. These findings do raise an important point about the relevance of surveying the professions if you're interested in launching Livable for Communities All Ages work in your community, and finding through the survey an opportunity for goal alignment. Another lesson learned was the importance of previous relationships. Having a previous relationship and working together on a previous project increases trust and reduces uncertainty of working together again. The most prominent group identified as working on livable communities for all ages were the area agencies for aging, followed by the category of quote unquote other, but included senior councils, citizen committees, and other nonprofits. Respondents indicated strong relationships with many other professions, including the health services and housing, and that the most important reason that they worked with other professions was due to that other organizations recognized role as a leader on those issues. These findings strengthen the argument for the need for cross-sector collaboration. We find that trust, reciprocity, and reputation, as noted in the literature, are important components of collaboration. In fact, 83% of respondents attributed their current success in the LCA planning arena to a previous experience working together. Over 50% suggested that a lack of advancement was due to a lack of municipal leadership. In fact, AARP's Age-Friendly Communities initiative requires a letter of commitment from the municipal leadership. A solid foundation for collaboration exists for both professions because both rely on similar components to advance planning, including visioning with residents and the public, establishing steering committees, and performing needs assessments based on community data. Further, opportunities exist for the integration of contributions by both professions. A significant and catastrophic incident, for example, such as the pedestrian fatality, does not appear to be what is driving action in communities. Rather, it's purposeful thought to planning and policymaking, finding policy opportunities, new funding opportunities, and thoughtful consideration on how to leverage a current program or project already underway in the community. So we have certain tools that we can continue to leverage to link these two professions together. Needs assessments and knowing demographics were identified as two critical tools in advancing livable communities for all ages work. These are standard engagement and data collection practices for both professions. And taking advantage of existing opportunities is important, but probably the most important strategy for the aging sector and aging professionals to engage community and city planners is inviting them to be part of your community's participatory process and your LCA initiative itself from the beginning. Working together helps both professions navigate policy changes that benefit older adults and paying attention to the needs of older adults and their wants. So going forward, Stephanie will now cover the research that they performed at the international level.
Great, thank you, Laura. So yeah, I want to talk about our international planner engagement work thus far. Essentially, this is a collaboration among AARP, the American Planning Association's International Division, AARP consulting firm, and a professor and PhD student at Cornell University. We essentially began this research with a very small grant of $7,000 from APA, but most of the work obviously was done pro bono by the core team that's listed on this slide, in addition to a group of volunteers who helped us with the survey development, its distribution, and some of whom continue to volunteer in a variety of ways. We distributed the Qualtrics survey instrument through partner organizations and through professional networks, and it remained open for almost 6 weeks at the end of 2017. An AARP senior research advisor helped me to decipher the data to develop these preliminary findings, and we're still essentially massaging the data, and we'll share final findings at the APA's National Planning Conference in April. So again, AARP and APA have primarily US-based audiences, but we reached out and heard from planners in 33 different countries, with the caveat that in different countries, and even within some countries, planners may not all be awarded the same level of authority. or independence in their work. So just to keep that in mind. We had a total of 559 respondents. And again, 72% were from the United States, and the 28% was essentially, we grouped into logical regions. So Australia and New Zealand comprised 9% of respondents. European countries together comprised 9% of respondents. Canada, 6%. And the Global South, which really includes very, very distinct cultures from all around the world and in much smaller numbers. So therefore, we're not reporting out on the Global South in some places where we've actually compared findings across a few regions. So just a little bit more on who our respondents were. In terms of community size, you can see on the graph to the left, the green representing 1 million or more residents. You can see that the respondents from the group that is Canada, Europe, Australia, New Zealand are in the center bar, are from larger communities than those in the United States, and even more so in the Global South, which comports with the rates of urbanization in these countries, as you can see in the blue on the land use pattern graph. We also looked at planners' work patterns. So the vast majority in the first two groups are from the public sector versus more private sector respondents from the Global South. And then the majority across the board have worked as planners for between 5 to 20 years. So now I'm going to go into some of the actual findings. So this first question, we asked people, planners, to indicate which of the following actions a local government that they work with has taken to advance LCA. And I want to point out that if a planner works as a consultant, we ask them to answer all of the questions with respect to one particular community that they work with on LCA. So we found, as you can see, that over 50% in the top two answers performed a walkability or accessibility assessment, that they incorporated LCA considerations into some kind of a major plan, a land use plan, a long-term transportation plan, for example. The third selection was impacted by the significantly lower number of US respondents who said that the local government adopted an actual policy that directly improves the quality of life for aging residents. So only 34% in the United States versus 66% among all other respondents. And then the lowest by far was signed onto a formal LCA program, which we defined as including the WHO Global Network of Age-Friendly Cities and Communities, or a national or regional network, or some kind of a grassroots program. So that indicates that we largely heard from planners who are doing LCA work, not necessarily in collaboration with an age-friendly or livable community program, but rather independent of those. We then asked why this local government made planning LCA a part of their practice. And we heard far above and beyond any other reason is really just an increasing awareness of rapid population aging and the need to better serve this segment of the population. And then second, at 50%, which was interesting, is that this was a priority identified during a community planning process. As far as the lowest two, sometimes we presume that decision makers are spurred into action by an incident, such as an older pedestrian fatality at a dangerous crosswalk, but this is proven very incorrect here and corroborates the finding from the US intervention that Laura just spoke about, where fewer than 1.5% of respondents indicated that such an incident was a trigger for this work. So that's what was an interesting finding to keep in mind now nationally as well as internationally. And then again, the absolute lowest selected was pressure from business leaders. And given that older adults wield substantial economic power, in fact, in the United States, 53% of consumer spending is generated by the 50+ cohort, this kind of low engagement by the business sector seems like a real missed opportunity. We then took the same question and looked at how planners from different countries and regions responded. So you can see the top 2 to 3 and the bottom 2 are the same across the board in terms of what I just presented. There are a few interesting outliers worth noting. So for Europe, in the middle of the chart, midway down, Europe ranked second, or the European planners ranked second, policies at the local, company, regional, or national level that mandate this perspective, whereas others rank this 8th or 9th. And then on the flip side, Europe ranked much lower local grassroots advocacy around an issue. And then finally, Australia and New Zealand ranked 9th out of 11, a policy window that presented an opportunity like a comprehensive transportation or pedestrian planning process, whereas in US, Canada, and Europe, these ranked either 3rd or 4th in importance. Next, we looked at specific areas of planning to examine the extent to which an all ages lens is incorporated into the planning practice. And we saw, as you can see, the top 3, over 50%, ranked either a 3 or a 4, meaning that the aging lens is incorporated into their planning practice to a greater extent in 3 areas. So our metric here was 0, which is the gray line, not at all, 1 to 2, which is the orange line to some extent, and then the blue line is 3 to 4 to a greater extent. And so the 3 highest areas here were parks and public spaces, community planning, and community and health services. And then the lowest out of ranking for 3 and 4, in other words, to a greater extent across the board, were economic development and resilience, despite the fact that we know older adults are among the most vulnerable populations, for example, in natural disasters. Again, a few outliers here. So Europe and Australia and New Zealand, there were actually far fewer respondents than in the United States and Canada, indicating that LCA was not included at all in resilience planning. So there appears to be more of a focus in those regions on the older adult population in resilience planning. And then in Europe, there were also far fewer than any other region who ranked 0 or indicated that LCA was not included at all in economic development planning. Next, we asked about what facilitates or impedes individual planners engaging in an LCA approach to their work. And so by far the most respondents indicated that what facilitates their working on LCA in their workplace is actually support from other colleagues. And then a distant second is workplace policies that encourage this approach to planning. The third overall, at 35%, periodic focus group interactions with aging population was actually the highest ranking of all in Australia and New Zealand, and actually tied for second in Europe. And certainly incorporating input from older adults themselves is an important part of every stage in the planning process. And additionally, there was a much higher proportion of respondents from Europe than from any other region who indicated that they were given release time to work on LCA, which is actually ranked the lowest overall from other countries. I also, in this question and then the few that follow, we gave an opportunity for people to list under the other section, beyond the selections that we provided, any other thoughts that they had. So in this case, other practices that facilitate their working on LCA. A few interesting things that came up were interdepartmental work, multi-generational staffing, professional organization membership, and then some funding that's tied to those practices. And then on the barriers that limit planners engaging in planning LCA, at the top, as you can imagine, is lack of funding, and then a focus on more traditional planning approaches, and LCA just not being a high priority. I found it's good to see that certain biases, aging bias and ageist bias and gender bias, did not appear to present major barriers. And I want to show a few outliers, and with the caveat that I'm showing these percentages that these countries and regions had fewer respondents, 17 in Canada and 25 in Europe for this particular question. So just keeping that in mind. But the points being made here are that Canada ranked highest by far, lack of time, which was also among the top 3 for Europe. And in Europe, political directives or a mandate from elected officials was higher than in other countries. In comments, we actually also heard a few times that some communities won't consider this in their work plan unless a council or mayor pushes the issue. And then in Europe, departmental policies was also a barrier for many respondents, unlike in other regions. In terms of some of the other barriers that people listed, I just want to share a few that were interesting. So a lack of citizens voicing a need or advocating for change. Indeed, one comment was that older residents are sometimes perceived as obstructionist. Another commenter said that departments outside aging or accessible services don't think about aging unless we remind them, and we aren't always there to do that. A few people commented on rural areas lacking the skills or resources needed. And then a couple of times local rules was mentioned. So sometimes not allowing, allowing for sidewalks in a right of way may not be a part of a project. So this in particular individual went on to say, but if not now, when? So the final 2 questions are aimed to better understand how we can more successfully engage these planners. And before we get to those findings, I actually want to turn this question over to you all and conduct a short poll. So for you all who are participating on this webinar, I'm going to ask Jessica if she can pull up the polling question. And this is regardless of whether or not you are a planner yourself. So Jessica, do you have that question to pull up?
Yes, I do. It should be on everyone's screen now.
Okay. So for some reason, I'm not seeing it, but I'm going to trust that everyone can see that we're asking from your experience, what strategies seem most effective to engage more planners to incorporate aging population considerations into their work? And we're asking you to just select one and not to rank them, the one that speaks to you the most. And we'll give about 30 seconds for that to run. And Jessica, is there any way that I can see this poll as well?
I'm going to close it out and see if you can see it when I close it out. If not, I'm happy to redo the results. I'm not sure why. You can't see it at the moment. Just give me 1 sec. Are you ready to close it out?
Let's give another 10 seconds for people.
Okay, no problem.
Okay, 5 more seconds, and then we're going to close out the poll.
Okay. I can show the poll results. Just give me 1 second. Stephanie, can you see the results?
I cannot, but if you want to go ahead and read them out to me, that would be great.
Sure. So we have engaging elected officials, legislators to talk about LCA. That was 48%. Hosting participatory meetings with planners and community was 40%. Hosting training or seminars on planning LCA was 21%. Launching public campaigns or advertisements about LCA was 12%. And then participating in a community-wide LCA initiative was also 21%.
Great. Okay, thank you. Let me now show you essentially what we got from that same question that we asked with a few more options, but we sort of grouped them together. So essentially specific strategies that seem most effective to engage more planners. There was less of a spread here, but with the top one around placing this agenda into elected officials' talking points, that was 65%, which was very similar to the top one that you all just ranked as well. And then we have essentially some outliers, and I think that the second one that the group ranked also was hosted participatory meetings and community with planners and community residents, which was 50% here as well. So quite consistent. And I want to again talk about a little bit of the outliers. Once again, with that caveat regarding the percentages from these countries or regions because of the numbers of participants. But again, just to highlight that Canada was much higher on hosting participatory meetings with planners and community residents on LCA, so 75% versus 50% overall. And then Europe was much higher on both undertaking tactical urbanism activities and launching public campaigns or advertisements about LCAs. Again, we gave people the opportunity to provide other strategies that they thought were effective. And so in Australia, they talked about urban design solutions. For example, designing neighborhoods that function as a traditional town, consulting the community and providing overwhelming evidence of need, which is what we heard at the beginning of this. Canada said webinars blessed webinars, and developers and urban design planners need to attend LCA types of events. So reaching broader into those communities of professions. Colombia specifically talked about addressing local cultures, which are clearly distinct. In the Philippines, they indicated that directives from authorities to implement LCA interventions are the most effective strategies. In the United States, a few people mentioned that all ages is not a sexy planning topic and suggested that it's better to merge into a buzz issue in planning than present it as its own issue. Additionally, someone talked about a paradigm shift within the planning practice that's needed, so that saying that urban planning as a field has failed to acknowledge our complicity in creating communities that are exclusionary. And then finally, that unless we acknowledge this problem, we will not be able to rectify it. And now we moved on to a question, not about the strategies, specific strategies, but about the motivators, sort of what catalyzes or motivates planners to participate in planning LCA. And to think about these motivators to undertaking this approach, I want to show this in the results in two ways. So the first one is a word cloud, just to give you sort of an image. As you can see, awareness of population and aging and their corresponding needs is very critical. Correspondingly, some planners mentioned the sheer number of requests that come in for aging-related reasons. Another one is an awareness of issues by and support from elected officials. Community or grassroots advocacy and demand or pressure from them was an important one. Funding came up again. And issues of equity were sort of the ones that kind of stand out. And then once again, some interesting responses on what catalyzes or motivates planners to do this work. So in the United States, some respondents said, we should message that it's more cost effective to include inclusive and accessible in the design process, that we should make people aware of opportunities and solutions to problems and issues, including peer community success stories. So rather than talking just about the problems, we should talk about the solutions and what's working. That personal experience or compelling stories from other people, such as narratives on how current land use practice impacts real people's lives, is important to hear. In Australia, planners seem to be motivated by, according to the survey, one person said a conscience and a value system which supersedes personal comfort at work, and a willingness to confront and be argued with. In Canada, someone said angry seniors getting on the mayor's case, and another planner said support of grassroots and local political leaders. In Ireland, we heard continued professional development credits while broadening professional knowledge. In Nigeria, the catalyst was passion, easy access to needed data, and effective participation from the client or people planners are planning for. In Slovenia, they highlighted intergenerational equity and quality of life for all people. In the United Arab Emirates, they talked about how it relates to the future goals of economic development. And in the UK, one person said it usually when it makes economic sense for clients, sadly, the market often dictates what we can or cannot do. And then another planner said, by taking an LCA approach, places are better for all people. So a key motivator, as they called it, was the quality of the resulting place. So that essentially wraps up the data presentation part of the webinar. And before we open it up to Q&A, I just want to make you aware of some related upcoming events. So the second summit, Livable Communities for All Ages Summit, will take place at the ASA Aging in America Conference once again, this time on March 29th at 9:45 to 1 p.m. It's led by AARP and APA representatives in California, where the conference will take place. And Dr. Laura Keyes will again lead a participant pre- and post-survey effort so we can continue to build our body of knowledge around cross-sector collaboration on this topic in the United States. In terms of the international study, we'll present more elaborate findings and launch a conversation with planners at a session at the APA National Planning Conference, which will take place on Saturday, April 21st at 2:45 to 4 p.m. We also will talk more about local planning and decision-making at IFA's 14th Global Conference on Aging in Toronto, which is August 8th through 10th. And then based on stakeholder conversations around our findings, we want to determine our next steps for a more in-depth piece of research and possibly a tool development for planners to successfully infuse aging considerations into their planning work. So as part of that process, we want your input both during and following this webinar. So we ask that you please complete the feedback survey that you will automatically receive following this webinar, which includes a couple of questions specific to our next steps. And additionally, we're creating a database and featuring some planner best practices around LCA. So if you have any to share, please be in contact with Michael Amabile, whose email is on this slide. So I think we'll go ahead and leave this slide up and open it up to questions.
Thank you so much for the amazing presentation. A few questions, but I'll start with the first one. So the first question is, the local government communities who performed a walkability assessment and or incorporated LCA considerations in their long-term plan, were these local governments based in rural, suburban communities or environments, or was it more in a city or urban or dense type of environment?
That's a great question, and my guess is that it is more in urban environments. Unfortunately, I cannot answer that question definitively yet. As I mentioned, these are preliminary results from this survey that just ended at the end of 2017. So we've been pulling together some the findings, but are digging deeper into the data, so that by the time we present this at the American Planning Association, we will be able to disaggregate based on those locations. But we just have not had the time and to do that yet in that depth.
Thanks. So the next question is, what is the role of organizations such as CARP and AARP in encouraging and building age-friendly communities?
So So AARP plays a leading role in the United States and on both encouraging and building age-friendly communities. People may be aware of a specific program under the broad Livable Communities frame that AARP runs. It's called the Network of Age-Friendly Communities, and it is an affiliate of the World Health Organization's global network of age-friendly cities and communities. So there are affiliates all over the world to that international program. There are approximately 550 cities and communities that are a part of that program, about 205 in the United States, from the United States alone. And then, of course, there are thousands of other communities that are doing this work, but just have not formally joined those programs. But AARP has a very important role to play within the United States, and then in terms of our affiliates, learning and sharing with one another so that we can exchange best practices and learn how to be more effective in this work moving forward. The other thing that I'll say is AARP has a very, very active website, aarp.livable.org. And it's through that you can get to a host of resources that are constantly being developed and improved, including a livability index, which is a way that we have online to rank a community for how livable it is for people of all ages. And that is actually going to be updated in the late spring. There's going to be an update to that index where communities will be able to see across a period of time the change that's been made in the different metrics that measure its livability and in the policies that portend for greater livability moving forward. So those are just a few examples of a lot of resources that AARP provides in this area.
Thanks. So the next question is, as you carried out the international component of your study, were you able to find existing government policies in the Global South that encourage and enable age-friendly communities?
That's a really interesting question. We did not get into specific enough depth in this initial international research to look at specific policies. That is just not something that we had the wherewithal to do. Again, this was just a real initial survey. Again, the purpose of it was to lift up the importance of this work, the importance of this collaboration, and the importance of us knowing better how to engage planners and how to resource planners with the kinds of tools that they need in order to be effective in this work. And so we're just starting to learn that, and hopefully in our next stage of more in-depth research that we'll hopefully get funding for and be able to move forward, that's where we would delve into possibly some of those policies in particular parts of the world. And so I really hope that you'll all take the time to answer the couple of questions in the follow-up survey so we can get your input. And again, at the APA's National Planning Conference, we're going to have a conversation with planners and hope to get more input for our next stage of research as well.
Okay, so the next question is, appealing to the cost-effective strategy, I'm curious if there is a good base of data to make generalizations around return on investment for age-friendly communities. I'm familiar with the national level infographics provided by AARP, but I'm wondering if there are state or regional level information sources.
That's a hard question to answer. It depends on the state or the region. So just by way of example, AARP just a few months ago launched a new program as part of the network of age-friendly communities, which is called the Network of Age-Friendly States. So we worked closely with the WHO, and which expanded the global network so that essentially subnational levels of government are now eligible to join that network. And so our new state program at AARP is very much consistent with that expanded eligibility. What that enables us to do in the United States is by having a state join, and the state of New York was the first one to join a few months ago. Massachusetts just joined, and we have a few other states that are in line in the process. And one of the things that does is it enables the state to take this on, and it means that the state is committed to taking this on and making the entire state more livable in terms of its, policies and procedures in the state government. But then it also will create a more enabling policy environment so that cities and communities that are part of, that are working on livability or age-friendly communities that are within that state will have the ability to work with the state more directly, to have policies that are at the state level, perhaps complete streets policies or other things to weigh in and perhaps hopefully provide less barriers to the work that they're trying to do at the state level, but actually enable them to do more effective work at the local level. So a part of that process also is our hope that states will provide more important data to the communities that are a part of their that are within the state, that are doing this work, so that they can move forward more expeditiously and more effectively. So that's one example of where the data sources will grow on that. I don't know, Laura, I know you worked in Georgia and a couple of other places. I don't know if you have any other thoughts to add to that in terms of some maybe existing sources.
I do have another source that I can offer with some important findings. Again, you're right, the academic research needs to continue to look at the cost effectiveness, but also there's a couple of sources that I can certainly share with the citations with Jessica that maybe she can include in sending out with the email to all the participants.
Absolutely.
Because I know some of Dr. Warner's research looked at the economic impact of elder services, but also from a practitioner standpoint, which may be interesting to people on the call. I do know that Grantmakers in Aging commissioned a report of all of the grantees that were recipients of their funds to work on aging in place or age-friendly communities efforts, and they have a report that's actually very accessible, just searching online under Grantmakers in Aging and the case for age-friendly communities. And this includes a very substantial portion about the value proposition for age-friendly communities in both economic benefits, building of social capital, and other findings related to housing and infrastructure. So I would recommend this also as a resource, maybe more from a national perspective, but it does get into important conversations related to expanding the labor pool and addressing labor shortages and how that may have an impact on the community, as well as productivity and business outcomes. So that may help answer the participants' question.
Great, that's really helpful, and thank you for reminding of that publication of a GIA. And I'll just elaborate a little bit, just to say that a few of those communities, I know in Atlanta and in Phoenix and Kansas City, they really did look very deeply at some comparisons, sort of the question of if you were to bring in, 1 million new, millennials into Atlanta versus 1 million new, older adults, immigrants into the community, what would be the economic benefit? And found, that the economic benefit from the older adults was significantly higher. So there are, some efforts out there to try to quantify this in a variety of ways, and I think that the case for age-friendly communities is a good place to start.
Thanks, Stephanie. The next question I have is, how big or how small does a project need to be to start introducing these concepts and be successful?
There is no size limit, and there is no size minimum, is the bottom line. I mean, we have in the network of age-friendly cities and communities, we have essentially a number of communities from Maine, actually more communities from Maine than any other state. And they are, some of them are towns as small as 250 residents. And then we have, cities that are, 1.5 million and more. So, so size is not an issue. The critical issue is the commitment at the higher levels of government and the multi-stakeholder engagement, including older adults in that engagement. Laura, do you have any other thoughts on that?
And I would say too is meeting with initiating the relationship with the municipal planner or the city planner or county planner to also, inventory things that they already have underway. I know just from the research we collected and even from discussions, just qualitative research with cities, is that a great starting point is leveraging a project or program currently underway that has an opportunity to be amended or integrate some of the the concepts of LCA where they may not have been considered before. And I can offer an example just to here locally. There was a city that had initiated all of the architectural plans for their new community recreation center and realized that they hadn't done a focus group specifically with older adults, and a staff member indicated the need, we should be doing this. And when they brought this focus group together, it was indicated to them that they really wanted a track and they didn't want all of the equipment that had been proposed. And so there was an initiative to go back and do all the architectural plans again to incorporate the track, which could have been saved by having a conversation up front. So, that doesn't seem easy per se, but because of the financial commitment to what was going on with the recreation center, but the conversation was really probably the place to start. And so hopefully that provides an example of just some of the low-hanging fruit that may be an opportunity to get the conversation going in your community.
Thank you. I'm just going to field a couple more questions before we end, but the next one is, could you see such a study on LCA being envisaged in emerging economies like Mauritius?
I absolutely think it's critical that we look at this in emerging economies as well. I know that Help Age International is a really great partner organization of ours that does a lot of work in emerging economies. While their focus is specifically on livable communities, there's a lot of work around older adults' rights and issues of equity and health. And I would definitely look at their website and some of the things that they're doing. And like I said, we work with them closely, and I'm sure that they're increasingly collaborations all the time. So that is something that I think is very, very well worth looking into.
Okay, the next question is, are there resources available for the types of training activities mentioned in the presentation, i.e. training town administrators or community planners on LCA principles and how to implement them?
Yes, absolutely, and that is something that we're hoping to develop even further. Essentially, what you just, or the questionnaire just articulated was the rationale behind the first Livable Communities for All Ages Summit that we did at the Aging in America conference last year, and even more so are doing moving forward, starting with the conference in 2018. In other words, as I said, the folks in California, the AARP and APA representatives in that state, are the co-chairs of this planning for this event, and are reaching out to local planners in that area to create further networking across these two professions at the local level, and provide real training for planners in a number of. And I know that in fact in California they're already looking at the California-based APA chapters is having, there are conferences that they have in the different chapters of the American Planning Association. So they're already looking at doing a similar kind of summit at the APA conference as well. And those are opportunities, again, we're doing it at the National APA conference, but we're increasingly looking for opportunities to partner at the local level. So my suggestion would be if you are a planner, to reach out to your some folks in your local area agencies on aging or other aging professionals, and begin this conversation. And if you're in the aging profession, to reach out to, there is an APA chapter, at least one in every state, I believe. I actually shouldn't be misquoted. There may be a few states that don't have chapters, but most states have at least one chapter. And I would reach out directly to them and begin this conversation to see what kind of educational opportunity you can create to enhance this collaboration and to create a network so that people are continuing to collaborate moving forward. And AARP will be very happy to provide all kinds of resources to help with that kind of initiative.
And I just want to add on to that you can easily access from the American Planning Association's website an aging and community policy guide that will help provide you with some, especially if you're coming from the aging services sector, with some of the language that will translate to the planning field. So if you want to initiate that conversation locally with your municipal planner, that guide might help you with some entry points to that conversation. And then also at the very beginning of this presentation, there was a slide that referenced another American Planning Association guide that Stephanie indicated, and it's the title is at the very beginning of the presentation, but it's also about age-friendly and supportive communities, and that may also be a really great resource for you to initiate that conversation.
Thanks, Laura. I just want to mention that IFA will also be sending out the slides, handout, and other resources as well after the webinar, so keep an eye out for those as well. Just before we wrap up, there's one final question, and the question is, how do you see the role of planners and the role of politicians in making these concepts happen collaboratively?
Well, the how is essentially the big question here that we're trying to begin to answer. And so we've gotten at some initial clues to some of those answers here in this international research. Those are the critical players at the local level in terms of making this happen. So that how do you engage them? How do you motivate them? What are the resources and tools that they need? How do you collaborate better? All of those are the kinds of questions that we really do need to continue to try to answer, and that's why we're asking for your input after this webinar in the survey, that instrument that will go out, as well as you feel free to send any of us, myself or to Laura or to IFA, emails with questions, with suggestions. We are very open to collaboration and want to continue to learn more about this, because it is so critical that we engage planners and engage local decision makers. Again, at the IFA Global Conference in Toronto this summer, there will be a more in-depth conversation on this topic of local planners and local decision makers, and so we're hoping that that some of you will join us, and that we'll be able to continue to advance this conversation with more data as well.
Thank you, Stephanie. So that concludes the webinar for today. I just wanted to extend a huge thanks to Stephanie and to Laura for this fantastic webinar, and also to reiterate what Stephanie said, which is that the IFA is open to questions. So if your question didn't get answered today, please feel free to send it on, and we will either answer it or send it on to the appropriate people to answer it as well. So thank you to everyone who attended, and thanks again, Stephanie and Laura.